In this edition of Tech It Out, we look at where we stand in the race for a COVID-19 vaccine after one pharma giant announced its candidate could be a 90% effective. From 5 to 6, China launches its first 6G test satellite into orbit. It's reportedly expected to be over 100 times faster than 5G. And China's submersible Fendouzhe sets a record 10,909-meter dive, aiming to reach the bottom of the Mariana Trench.
Well, since 2003, the world has faced 3 outbreaks caused by the coronavirus family. But a vaccine was absent during the outbreak of SARS and MERS, and very likely this time too. But it's not all bad news. What many people don't realize is that over the past 17 years, the time it takes to develop a vaccine has drastically shortened. Vaccines usually carry inactive disease-causing proteins made by virus. This works by mimicking how a virus infects your body. They stimulate the body's immune response and create antibodies. This primes the body to respond more rapidly and effectively if exposed to the infectious agent in the future. In the case of the coronavirus, this protein are those spikes, which look like crowns. The spike protein works as door opener, allowing the virus to get inside and infect the cell. A vaccine for coronavirus will copy what those spike proteins do to prompt the immune system, but it does so in a safer way. Viruses that are inactive or made weaker can work as vaccines. Firstly, scientists isolate and acquire the actual coronavirus. This step has been done by scientists already. The virus is then cultivated in the lab using chicken eggs or other mammalian cell. Then it's developed into a less threatening version. In recent years, a new method has emerged called RNA vaccines. It takes advantage of the way cells make proteins. A cell will use its genetic material, the DNA, as the template to make messenger RNA. This RNA will give out orders to build proteins in the cell. So an RNA vaccine consists of a messenger RNA strand that coded for virus proteins instead of normal proteins. Once it's delivered into your body, the cell will use genetic information of the virus to produce foreign protein, causing immune reactions. A major advantage of the RNA vaccine is that as soon as we know the entire genetic code of the coronavirus, which we did in the beginning of January, RNA can be produced in a lab using readily available materials. It's less expensive and way faster than conventional methods. Not only this, but RNA does not integrate itself into the host genome and is degraded once the protein is made, so theoretically, it's safer. Of course, it's not perfect. It may cause an unintended immune reactions. Delivery is another challenge because free RNAs in the body are quickly broken down. The vaccine needs to be frozen during transport as well as storage. And no matter how rapid the timeline is for vaccine development, animal testing and clinical trials are still rate-limiting steps. And even if time can be squeezed, mass-producing vaccines quickly is another huge challenge. Those shots weren't ready in time in the last 17 years. Research on SARS and MERS vaccines has allowed scientists to be better prepared than ever. Some experts believe that because different types of coronavirus can share similarities, a universal vaccine could theoretically be developed. Given we have been hit 3 times during the past 2 decades, we can only hope for such a result.
Welcome to Science Saturday. I'm Kasturi Manikam. Today we look at science news ranging from the world's first 6G experimental satellite to a COVID-19 vaccine. First, China has put the world's first 6G test satellite into orbit. It's one of 13 aboard the Long March 6 rocket, which blasted off a week ago from North China's Shanxi province. It will test the performance of the 6G frequency band in space. The technology is reportedly expected to be over 100 times faster than 5G. The satellite will also be used in areas like smart city construction, disaster prevention, and environmental protection. A COVID-19 vaccine has proven to be more than 90% effective. Pharma giant Pfizer and its German partner BilNTech are the first drug makers to show such promising data from a large-scale clinical trial. The companies say they've found no serious safety concerns so far. Both companies expect to seek U.S. emergency use approval later this month for people aged 16 to 85. They have a $1.95 billion contract with the U.S. government and have also reached supply agreements with the European Union, the UK, Canada, and Japan. China's deep-sea manned submersible has set a new diving record. The Fendouzhe, which means striver in Chinese, descended over 10,000 meters in the Mariana Trench on Tuesday. The submersible is equipped with groundbreaking deep-sea communication technology and can send live video signals back to its supporting ship. It will aim to reach the bottom of the Mariana Trench, the world's deepest known trench at more than 11,000 meters. China plans to launch its Chang'e 5 lunar probe at the end of the month. It will make a softer landing on the moon and bring samples back to Earth. China's current lunar program involves 3 phases: orbiting, landing, and return. The first 2 phases have been completed. Other tasks of the probe include taking off from the moon, docking on lunar orbit, and high-speed re-entry into the Earth's atmosphere. If the mission succeeds, China will become the 3rd nation to do so after the United States and Russia.
Well, that's all for today. If you have any comments, please let us know and stay in touch with us on our website and social media platform. This is CGTN's Tech It Out. See you next time.